Welcome to Aries Health Channel. Are you worried that the pain in your chest could be something serious? You need to watch this if you struggle with chest discomfort or uncertainty about what it means. It can be very worrying when you feel a pain in your chest. The first thing many people think about is their heart, and that can make you feel quite scared. However, it's important to know that chest pain is very common, and it has many different causes. Not every ache or sharp feeling in your chest means something is seriously wrong with your heart. Your chest is a busy place, full of different parts like muscles, bones, your food pipe, and your lungs. Any of these things can be the reason for the discomfort you are feeling, so taking a moment to understand what is happening is a very good first step. Sometimes the pain might feel sharp and quick, like a little poke. Other times, it might be a dull ache that lasts for a while. You could feel it spreading to your shoulders, neck, or arms. It might feel like a squeezing or a burning feeling. The type of pain you have and what you were doing when it started can give us clues about what is causing it. For example, if you have been lifting heavy boxes, you might have just pulled a muscle. Or, if the pain comes on after a very big meal, it could be related to what you ate. Understanding the different reasons for chest pain can help you feel less anxious if it happens to you. It's like being a detective for your own body. Did the pain start suddenly, or did it build up slowly? Does it feel worse when you breathe in deeply, or when you move a certain way? Answering these questions can help you figure out if it's something simple you can manage at home, or if it's time to get some help from a doctor or a nurse. It's always better to be safe and get things checked out if you are worried. The main takeaway is that while chest pain can be a sign of something serious, it often isn't. Many times it is caused by something much less worrying, like indigestion or a strained muscle. By learning about the common causes, you can be better prepared and know what to do next. This knowledge empowers you to take control of your health and make sensible decisions. It helps you to stay calm and think clearly, which is always helpful when you are not feeling your best and need to decide on the next course of action. Let's talk about some of the most common reasons why your chest might hurt. One very frequent cause is indigestion or heartburn. This happens when acid from your stomach travels up into your food pipe, which is called the esophagus. This can create a burning feeling right in the middle of your chest, and it often happens after you've eaten a large, fatty, or spicy meal. Another cause can be a peptic ulcer, which is a small sore on the lining of your stomach. This can also cause a burning or gnawing pain that might feel like it's in your chest area, even though the problem is in your tummy. Sometimes, the pain has nothing to do with your organs inside, but is actually coming from your muscles or bones. You have lots of muscles between your ribs, and if you strain one by coughing a lot, lifting something heavy, or even sleeping in an awkward position, it can feel very sore. This type of pain often gets worse when you press on the area, take a deep breath, or twist your body. It's a bit like pulling a muscle in your leg, but because it's in your chest, it can feel more alarming than it really is. Rest is usually the best medicine for this kind of pain. Your feelings can also cause physical symptoms, including chest pain. When you feel very worried, stressed, or have a panic attack, your body can react in powerful ways. You might breathe very fast, your heart might beat rapidly, and your chest muscles can become very tight. This can lead to a significant and frightening pain in your chest. The pain is very real, but its cause is anxiety, not a problem with your heart. Learning to manage stress with breathing exercises or talking to someone can make a big difference if this is happening to you. Of course, sometimes chest pain is related to your heart. A condition called angina happens when the heart muscle doesn't get enough oxygen-rich blood, causing a squeezing or tight feeling. A heart attack is more serious and happens when the blood supply to a part of the heart is blocked completely. This pain is often described as a severe pressure, like an elephant sitting on your chest, and it can spread to your arm, jaw, or back. It's very important to know the signs of a heart problem because this is a medical emergency that needs immediate attention. If you have looked at the situation and you are quite sure your chest pain is mild and not from a serious heart problem, there are a few simple things you can try at home to feel better. For pain that you think is caused by indigestion or heartburn, a good first step is to stand or sit upright, as lying down can make it worse. Drinking a glass of water can help wash the stomach acid back down. You can also try an over-the-counter antacid medication. These are medicines that you can buy from a pharmacy that help to neutralize the acid in your stomach and can provide very quick relief. If you suspect the pain is coming from a strained muscle, the best thing you can do is rest. Avoid any activities that make the pain worse, like heavy lifting or strenuous exercise for a few days. You could also try applying a warm compress or a heat pack to the sore area. The warmth can help to relax the tight muscles and ease the discomfort. Taking a simple painkiller like paracetamol can also be very effective for this type of muscular pain. Just be sure to always follow the instructions on the packet and never take more than the recommended dose. For chest pain that might be linked to feeling stressed or anxious, focusing on your breathing can be incredibly helpful. Try to find a quiet place to sit down comfortably. Close your eyes and take slow, deep breaths. Breathe in through your nose for a count of 4. Hold it for a moment, and then breathe out slowly through your mouth for a count of 6. Repeating this for a few minutes can help calm your nervous system, slow your heart rate, and release the tension in your chest muscles. Sometimes just realizing that anxiety is the cause can help the feeling to pass. It's also a good idea to think about your lifestyle. If you often get chest pain from indigestion, try to eat smaller meals and avoid foods that you know trigger it, like very spicy or greasy dishes. Staying hydrated by drinking plenty of water throughout the day is always a good habit for your overall health. These simple home remedies and lifestyle adjustments are great for managing mild and occasional chest pain. They give you the tools to take care of yourself when the cause is something simple and not a cause for immediate alarm. While many cases of chest pain are not serious, it is crucial to know when you must seek medical help straight away. You should call for an ambulance immediately if the chest pain is severe, feels like a heavy pressure or squeezing, and lasts for more than a few minutes. If the pain spreads from your chest to your arms, especially the left arm, your back, neck, or jaw, this is another major warning sign. These are the classic symptoms of a heart attack, and getting help as quickly as possible is the most important thing you can do. Time is critical in this situation. You should also treat it as an emergency if your chest pain comes with other serious symptoms. If you are also feeling very short of breath, struggling to breathe, or feeling dizzy and lightheaded, do not wait to see if it gets better. Feeling sick, being sweaty, or having a very fast or irregular heartbeat alongside the pain are also red flags. These combinations of symptoms suggest that something more serious could be happening inside your body, and a doctor needs to find out what it is without any delay. It is always better to be overcautious. Even if the pain is not severe, you should make an appointment to see your doctor if it keeps coming back, or if you are worried about it. If you have a dull ache that doesn't go away after a few days, or if you find that you are getting chest pain more and more often, it's a good idea to get it checked out. Your doctor can talk to you and do some tests to find the underlying cause. This is especially important if you have other health conditions like diabetes, high blood pressure, or a family history of heart disease. In summary, the key is to listen to your body and not ignore strong warning signs. For very mild pain that you can link to a simple cause like a pulled muscle or eating a big meal, home remedies are often enough. But for any pain that is severe, spreading, long-lasting, or accompanied by other worrying symptoms like breathlessness or dizziness, you must seek medical advice. Don't try to diagnose a serious problem by yourself. Doctors and nurses are there to help you, and getting a professional opinion will give you peace of mind and ensure you get the right treatment if you need it.